Welcome to Tuesday's edition of COVID-19. Authorities here in the Greater Seoul area are launching enhanced prevention measures as part of efforts to better curb the spread of the virus in this region. We have details on that and on efforts to facilitate cross-border exchanges among vaccinated people in the near future. We start now with the broader pandemic coverage. So, what are the COVID-19 numbers for Korea on this Tuesday?
Well, Sunny, we have a slight drop in infections this Tuesday with 363 infections reported as of 12 a.m., but that might still reflect the fewer testings over the weekend. And domestic infections have dropped to around the mid-300s with 18 imported cases this Tuesday. And that raises the total accumulated number of infections to 96,380 with a total of 1,678 fatalities. If we take a look at our graph now, for 2 consecutive days, we have dropped down to the 300s, but it's still too early to be relieved. If we take a look at where the recent cases have occurred, we see quite a surge here in Gyeongsangnam-do province with many infections linked to public saunas here. And although we have a drop in the capital here to the double digits, still triple digits in Gyeonggi-do province, and many cases here in the metropolitan region are linked to workplaces and day-to-day venues. So as recent cases are still concentrated in the Greater Seoul area, the government has announced special antivirus measures in this region, including stronger rules and inspections at public use facilities such as parks and department stores. But our Kim Da-mi is going to go into the details in a bit.
Right, she will later on. Meanwhile, so I understand efforts are underway to encourage greater public support for the vaccination campaign here.
Right, Sunny, especially as vaccination for the general public will soon kick off. Officials are hoping that mass inoculations will help in bringing down the daily COVID-19 figures. And to further promote public cooperation, Prime Minister Jung Se-kyun had this suggestion to make.
Normal immune responses such as fever or pain have been reported in substantial numbers. There's a need for a vaccine holiday system to encourage the public's participation in the vaccination campaign and put their worries to rest.
Let's also get an update on the number of vaccinations completed so far. Over 602,000 with almost 12,000 inoculations yesterday. Now, despite vaccinations, over in Italy, the European country that was the first European country to get into a lockdown last year, now has imposed an Easter lockdown amid a rising number of variant cases there. Meanwhile, over in the U.S., the CDC gave a warning on Monday over a spike in travel as the country recorded a one-year record high of air passengers in just a day, over 1.3 million on Friday, and also a similar figure on Sunday. Now, this warning comes amid still over 50,000 cases on a daily basis here in the U.S., almost 57,000 in the past day, now having again more cases than Brazil at 42,000, and also other countries with high daily increases here, India, as well as Italy and Turkey. And the total number of infections around the globe stands at 120.7 million. Those are the updates I have for now, but I'll be back in a bit after the government briefing. Sunny?
All right, so thank you for now. Back at the local front, earlier this morning, authorities here vowed extensive inspections of venues prone to potential cluster infections as part of broader intentions to enhance prevention efforts here in the Greater Seoul area. I have Kim Da-mi in the studio with details on that. Welcome, Da-mi.
Good afternoon, Sunny.
Right then, Da-mi, do tell us more about these on-site inspections.
Right, with much stricter preventive measures, the government is aiming to lower daily cases to below the 200 mark. Let's take a listen.
The latest restrictions in the metropolitan area are aimed at curbing the nationwide spread of the virus.
Now, these special prevention measures include tighter inspections at venues where prevention rules have been frequently violated. And in Gyeonggi-do province for 2 weeks, the health authorities will randomly inspect places that are at high risk of cluster infections. And due to large cluster infections from workplaces with foreign laborers, health authorities will be teaming up with local governments from Seoul and Gyeonggi-do province and strengthen prevention measures at workplaces where many foreign workers are employed. And they'll be inspecting an additional 2,500 workplaces deemed to be especially vulnerable. And health authorities will also target 30 venues where many people visit in the springtime, such as parks, department stores, and shopping plazas.
I see. Meanwhile, on the vaccination front, Tami, I understand the President and the First Lady are poised to receive their first doses of the COVID-19 vaccine.
That's right. They'll be getting AstraZeneca vaccines next Tuesday, of course, in accordance with the manual drawn up by the KDCA for essential foreign travel. Take a listen.
March 23rd is when the country will start giving doses of the AstraZeneca vaccine to those 65 and older. The first couple will get priority that day, so as to ease concerns over the vaccine's safety and efficacy.
President Moon is 68 and the First Lady is 66. Moon has been invited to attend the in-person G7 meeting in the UK between June 11th and the 13th, and his first dose was expected to be administered in late March, given that the AstraZeneca jab requires 2 doses given 8 to 12 weeks apart. And also, some Blue House officials who will accompany the president will also get their shots on the same day.
Right, Tami, also do touch upon the second quarter vaccination plan for us a bit.
That's right. So South Korea aims to have administered 1.2 million doses of vaccines. And the goal for the second quarter is to carry out another 10 million, targeting 6 priority groups. The first in line are people aged 65 or older. This will apply to around 8.5 million seniors here in the country. And the oldest among them will be the first in line. Take a listen.
For people 75 and older who have issues with mobility and registering online, the government will team up with local administrations to provide a wide-ranging service from registration and transport to the vaccination site, the inoculation process itself, the trip home, and post-vaccination monitoring.
And then the next in line will be residents and staff members at care facilities for the disabled and the elderly. That includes for some 250,000 people, and patients on dialysis will also be inoculated. And on top of these people, more groups have been newly added to the Q2 list. That includes teachers amid growing calls to protect schools that have recently kicked off the spring semester. And those inoculations will be conducted in phases, starting with those at schools for children with disabilities, then to kindergartens and the lowest grades in elementary schools. Now, moving on to the healthcare sector, those working in dentistry, pharmacies, and oriental medicine clinics will get their turn since frontline workers have already gotten their first doses in the first quarter. Now, essential public sector workers like soldiers, police officers, and firefighters will be inoculated sooner than originally planned. Initially, they're going to be vaccinated in the third quarter. And then flight attendants will also be included in the Q2 vaccination timetable, given their risk of transmitting to new COVID-19 variants since they're currently exempt from the country's mandatory 2-week quarantine period. In all, the government is aiming to administer a total of 12 million doses by the end of the second quarter.
I see. Now, before you go, Tami, what is the latest with regard to investigations on post-inoculation fatalities here?
Right, so the 6 deaths under investigation all involved underlying health conditions. 4 of them were determined to have no direct links to the vaccines, while the remaining 2 cases will be evaluated depending on the autopsy report.
No serious adverse reactions have been reported, leading us to the conclusion that there are no issues either with the vaccine itself or the inoculation procedures.
So far, 16 post-inoculation deaths have been reported in the country, with health authorities ruling out vaccines as the cause in 12 of those cases.
All right, Tami, as always, thank you very much for that coverage.
My pleasure.
Right, up next, we are poised to join the regular briefing on the COVID-19 situation here on the local front for this Tuesday. We'll come back to you afterwards.
분석단장의 브리핑 설명이 있겠습니다.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea for March 16th, Tuesday. As of today midnight, we have 345 new local infections and 18 new imported cases. The total caseload now stands at 96,380. And yesterday, we carried out a total of 72,874 tests. And among them, at the makeshift testing centers in the metropolitan area, we carried out 31,737 tests, confirming 45 confirmed patients. And 501 additional patients have been discharged, while 6,447 people still remain in quarantine undergoing treatment. And we have 4 more people with critical or severe conditions, standing at 103. And we had 3 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And here are our updates of the domestic infections in the metropolitan area. In Seoul's Gwanak-gu district, in relation to a beauty salon, as well as a Junggu district healthcare facility, we identified 22 additional cases, and in total, we have a total of 23 patients being confirmed to date. And in Seoul's Sangdong-gu district, in relation to an office, and also related to a church in Yangcheong-gu district, we also identified 13 additional patients, and a total of 14 have been confirmed to date. And in Gyeonggi-do Province, Bucheon City, in relation to a cosmetics product manufacturing company, we identified 10 additional patients, and a total of 11 have been confirmed to date. And moving on to Chungcheong Province, in Sejong City, in relation to an insurance company, we identified the first index case on the 11th of March. We have 9 additional patients being confirmed, and in total, 10 have been confirmed to date. And in Chungcheongbuk-do Province, Daecheon City, in relation to a public sauna, we have 14 patients being confirmed. A total of 41 have been confirmed to date. And in Gyeongbuk Province, in Gyeongsangbuk-do Province, Yecheon-gun County, in relation to a nursing hospital, we identified the first index case on the 6th of March. We have 4 additional cases, raising the total to 5. And in Gyeongsangbuk-do Province, Goryeo-gun District, in relation to a workplace, we have 3 additional patients being confirmed, and raising the total to 17. And in Gyeongsangnam-do Province, in Gyeongnam Jinju City, in relation to a second bathhouse, we have 26 patients being confirmed, and in total, we have 176 being confirmed to date. And in Gyeongsangnam-do Province, Jinju City, in relation to a company there, we identified additional patients of 12, and a total of 13 have been confirmed to date. And in Gyeongsangnam-do Province, Geoje City, in relation to a nightlife entertainment venue, we identified also additional patients of 31 more people, and a total of 34 have been confirmed to date. And in Gangwon-do Province, in Gangwon-do Province, Sokcho City, in relation to a gymnasium, we identified the first index case on the 14th of March. We identified 14 additional patients, and a total of 15 people have been confirmed to date. And moving on, we have seen major cluster infections centering around public bathhouses, and we have done some analysis, and here are some risk factors. First of all, in Ulsan City, in relation to a bathhouse there, we identified the first index case on the 7th of March, and a total of 53 people have been confirmed to date. And in Jinju City, in relation to the bathhouse number 2, we identified also an additional of 176 people, a total of 176 people as well. And also, in these 2 cases, we have seen many people who have visited these public saunas, despite the fact that they had clinical symptoms. And also, they had also the regular membership at these saunas, and they were also transmitting the virus to their colleagues as well as family members. And later on, we have seen also chain transmissions going to companies and daycare centers, as well as other multi-use facilities. And these cases show that in the these were the facilities located at the residential area, and most of them were under the membership, and they visited these facilities about 2 to 3 days per week. And despite the fact that they had some flu-like symptoms, they visited these facilities on a regular basis, and they were exposed to the virus on a regular basis as well. Moreover, we also see that these facilities had poor ventilation systems, and also at the locker rooms and the saunas, as well as the indoor sports facilities, we see that the users stayed for a very long time, and it was difficult for them to wear face masks. And also, due to the regular membership program, they had a regular exposure to the virus. And we ask you to also note that if you have any flu-like symptoms or any other symptoms, suspected symptoms, we ask you to get tested as soon as possible instead of visiting such public saunas. And also, when you are visiting such public saunas, we ask you to refrain from engaging in dialogue with others, and also minimize the time of stay at these facilities as well. Moreover, we ask the managers of these public bathhouses to see if the users have any flu-like symptoms or any other suspected symptoms of COVID-19, and also help them to prevent and also refrain from consuming food inside these facilities, and also carry out ventilation and disinfection on a regular basis to protect the workers as well as other users. And next, we have some updates of the COVID-19 vaccination program here in South Korea. As of March 16th, midnight, 11,922 more people have been administered with their first dose of COVID-19 vaccine, and a total of 602,150 people have been administered with the vaccination, and a total of 75.8% of the first target group have also been vaccinated. And at care facilities, we also see many people getting vaccinated as well. And also first responders, more than 44,000 have been administered with the drug, and more than 260,000 at hospitals, and also more than 26,000 at the COVID-19 hospitals have been administered with the vaccination. And we also have a post-inoculation adverse responses. We have a total of 8,751 reported so far, and a majority of them, 8,650 are mild and common symptoms, including muscle pain, headache, fever, and nausea. And there were 77 suspected cases of anaphylaxis, 8 cases of convulsion, and 16 cases of death so far. Lately, we are seeing the daily tally hovering around 400, and this number is being stagnant for the time being. And however, we are seeing a slight increase in our daily tally. And we are seeing cluster infections breaking out at public saunas as well as workplaces. And we also have the higher risks stemming from higher physical contact due to more travel in the spring weather. And also, we have the risks posed by the new variants. And we also are at the verge of another possible fourth wave outbreak. However, we believe that stricter quarantine measures could help us also prevent a possible fourth wave. What we want to highlight is that if you have any symptoms, we ask you to refrain from going to multi-use facilities. We have seen the analysis lately, and at most of the cluster infections, a majority of them actually had symptoms, and also this led to nth transmissions. And according to our own calculation, we see that it is very important to contain the entrance of these people with clinical symptoms to visit these public facilities, and we believe that preventing them from visiting these places could decrease the risks of the virus spreading to about 23%. And if you have any pain in your body, please also visit the screening clinic as soon as possible, rather than visiting a public sauna to relax yourself. However, also note that visiting the public sauna, this can be very detrimental for the spread of the virus to others, because it is a confined place. Moreover, if you have any cardiovascular diseases or high blood pressure, and also any other people with the underlying illnesses, would also be prone to such risks as well. As we see the current trend continuing for the time being, it is also not safe for us to say that I myself would not be contracting the virus. And we cannot exclude the risk that we can be exposed to the virus at any time, at any place. Moreover, we need to take particular notions at the fact that the COVID-19 has different symptoms depending on the people. And we also have earlier carried out about the survey conducted on about 9,000 patients of COVID-19, and we saw that about 20% of them had fever, or about 43% of them had coughs. And if you are not feeling well, if you feel sick, and if you visit these public saunas, it is also posing a great threat not only to your health, your own safety, but also those of others as well. And if you feel ill, please do not go to these public saunas. Please go to a doctor and also get tested. And together with the beginning of the new school year, and also together with the spring weather, we also see more people traveling. And this also concludes the briefing. I would like to conclude by taking particular notions of the following aspects. If you are also going to public use facilities, please wear your face mask and also keep a good distance with others. And the quarantine authorities would also exert our full efforts to carry out massive testing to identify patients at an early pace. And we would also like to contain the virus going forward. And we will also intensify our monitoring and inspection for the virus vulnerable facilities. We will also be exerting our full efforts on our end as well. Thank you very much.
Right, that was Lee Sang-won with Tuesday's afternoon briefing. So what did he have to say?
Well, the official had some risk factors regarding public sauna visits because we've been seeing a lot of cluster infections at such facilities. And he was especially referring to big outbreaks in the cities of Ulsan and in Jinju. And many cases there have led to chain transmissions to colleagues, family members, daycare centers, and also multi-use facilities. And it looks like many of these people, those visitors to those public saunas, had regular memberships, which means they went on a weekly basis or 2 to 3 times a week. And the thing is that they went there despite having symptoms of the COVID-19 virus. So he stressed that if you do feel sick or have any virus-like symptoms, do not go to such multi-use facilities. And also, if you do go to such places, you should not talk with other people.
Right. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right. Over 600,000 people have received their first dose of the COVID-19 vaccine here in Korea since the inoculation drive began on February 26th. Now, there have also been 16 reported deaths among these people, and investigations of most, that is, of these unfortunate losses have been concluded so far, and they reportedly show no link to the vaccines. Do take a look.
조사 대상 6건의 사망 사례 중 4건은 예방접종과 직접적인 인과성이 확인되지 않았고 2건은 부공 결과를 확인한 후에 재평가하기로 하였습니다.
The Korean government has announced the latest findings of its investigation into several post-inoculation deaths that have been reported in the country. The government reached a preliminary conclusion that there was no causal link between the vaccines and the reported deaths, after judging that the vaccines themselves were not compromised in any way, and that no serious adverse reactions were observed, on top of the fact that all 8 people who died were suffering from underlying health conditions.
사망의 원인이 기저질환의 악화와 같은 다른 요인에 의한 거를 배제를 먼저 해줘야 하는 거거든요. 접종이 시작된 이후에 접종 전과 비교해서 확연한 사망의 증가가 있어야 돼요. 진짜 이런 게 만족되지가 않으면 저희가 인과관계가 있다고 말하기가 좀 쉽지가 않는 거죠.
But these findings do not suggest that those with underlying health conditions shouldn't be vaccinated.
기저질환을 전 세계에서 제한하라는 게 없기 때문에 우리나라에서도 마찬가지로.
On the contrary, patients with chronic illnesses are categorized as higher-risk groups for whom vaccines are prioritized. but they need to undergo a thorough health checkup before getting their shots. Also, severe allergic reactions or anaphylaxis can occur in anyone, even those with a clean bill of health. According to local researchers, anaphylaxis can be triggered by a wide variety of foreign substances aside from vaccines.
우리가 해파리에 쏘인다거나 벌에 쏘이게 되면 외부의 독소가 몸에 들어오게 되죠. 그런 과정에서 아나필락시스가 생길 수 있는 거고요. 그다음에 음식물을 섭취한다거나 그런 과정에서도 일반적으로 생길 수 있습니다. 10만 명당 4명에서 6명 정도가 월별로 발생하는 걸로 되어 있습니다.
Anaphylaxis is typically an acute, rapid onset condition that occurs within 30 minutes post-inoculation, providing a predictable time window to render emergency medical aid.
아나필락시스는 적절한 대처를 하면 사망은 거의 일어나지 않습니다. 일반적인 사람은 대개 15분 정도 관찰을 하면 되지만 혹시 이렇게 과거에 약물이나 백신에 대한 알레르기가 있었던 사람들은 좀 30분 정도 의료기관에 머물면서 상태를 관찰할 필요가 있는 거죠.
Numerous post-inoculation deaths have been reported worldwide. However, Europe's drug regulator announced that vaccines were not to blame for the death of a nurse in Austria who succumbed to a blood clot after getting vaccinated. In the UK, where second doses are now being administered, no causal links have been found between the vaccines and post-inoculation deaths in a series of research carried out by the government.
Most of those vaccinated in the UK and generally in Europe are those who are elderly. And so we get considerable numbers of people who die just by chance.
With AstraZeneca vaccines being approved in Korea for seniors aged 65 and above, the country's health authorities are on heightened alert over the possible emergence of more adverse reactions.
In our follow-up data in Scotland, in England, we have seen pretty good efficacy for the AstraZeneca vaccine and for the Pfizer vaccine. The only way you can protect yourself other than by avoiding all contact with people is to be vaccinated.
Further probes and inquiries will have to be made in order to continue learning about the human health effects of COVID-19 vaccines.
核酸检测还有疫苗接种等各方面信息的相互验证，从而来助力安全有序的人员交往。
Wichtig war noch als letzter Punkt war der digitale Impfnachweis. Hier sind sich alle einig, dass wir so etwas brauchen.
At the present time, the use of certification of vaccination as a requirement for travel is not advised because, quite simply, vaccination is just not available enough around the world and it's not.
외국에서도 지금 현재 예방접종 증명서를 발급을 했을 때 그 발급에 따른 후속적인 조치들을 어떻게 해야 될지에 대해서 지금 현재 검토를 지금 하고 있는 그런 이제 사항입니다.
With vaccination campaigns taking place in quite a few countries worldwide, debate over vaccine passports has been reignited in hopes of facilitating cross-border travel among those who have been inoculated. Now, for more on the medical and diplomatic implications of this initiative, I have Dr. Yoo Byung-wook from Soonchang University Hospital. Welcome back, Dr. Yoo. And I also have Professor Choo-jae Woo from Kyunghee University. Pleasure to see you again, Professor Choo.
Likewise, same here.
Right, Dr. Yoo, authorities have agreed here, that is, to adopt a digital vaccine verification. Now, such a verification in itself is not unusual. Can we start with a few other examples?
Well, medical certifications for the vaccination, we are quite used to. Why? When we send our children to the primary school, we have to submit for the vaccination record. Who are the shortened, we highly recommend have a vaccinated, pretty safe for all the children and students in for primary school. So second, we have opportunity to study abroad, the US or UK. That time the school and college and universities require for meningococcal meningitis or hepatitis A for the case of stay on the dormitory because of for all the safety. Yes, they're really kind of true. COVID-19 vaccine certified is quite necessary for people who had an S record, but we have certain issues. Why? Because these days we have the face on new variants of the COVID-19. So probably we need 10 more papers on the line to certify the different types. So which is mean COVID-19 certificated is good enough for the traveling for the shortly and the motive of the visit or overseas. But it doesn't help to cover they are saved from COVID-19 permanently. So from the beginning, not only Korean governments, other governments beginning of the talk about the kind of green pass or COVID-19 passport, we have to consider about the fact as like the scientific basis. At the same time, we are considering all about the neighborhood of the country who still short of the vaccination.
Right. Meanwhile, Professor Chu, please tell us a bit about neighboring China's health verification proposal, as we saw in the video earlier on.
Yes, the official name is the Health Certificate for International Travelers. And I think the purpose is to really inform other countries that Chinese nationalities are safe from the COVID virus. And obviously, it will contain information of the holders on, serum antibody tests and coronavirus and inoculation status and so forth. I think the Chinese initiatives comes with three expectations. I think what they have in sight is obviously the upcoming, Beijing Winter Olympic Games in February of 2022. And obviously they would like, as a host, they would love to see the Olympic Games would be full of participations and audience and so forth, and instead of crowd-free stadiums. And the second is obviously they would like to contribute to the world economy's fast recovery and by facilitating the international travelers across the borders.
Right. Yeah. Dr. Yu, you mentioned this earlier, but can a vaccine passport guarantee full protection against COVID-19, speaking as a medical expert?
Well, that's why this is the COVID vaccines passport doesn't guarantee for all for the saved. Since the yellow fever vaccination started, we prepare for yellow vaccinated certified. We can call yellow card. Yellow card, it helps to understand who had the vaccination against the yellow fever. But yellow fever is the transmit for the mosquito. It's very fatal, incomparably fatal than COVID-19. That's why we highly recommend who are traveling to the required to COVID yellow fever vaccination, especially for Africa and certain countries of the middle, middle and South America, they should. But it doesn't mean you not get it the yellow fever, which means this record mean you have a vaccination, but it doesn't mean you are free from the disease. So it's a kind of record. So which means you're relatively safe than other persons. Also, this is kind of require for your safety for the travel. But if we are started as like the COVID passport as like the kind of, how to say, stigma, who doesn't have the passport mean who are poor is not enough to the traveling person, like a stigma, or who are person who are qualified and selected who had a passport. So we don't want it like that. Why? This kind of green pass or COVID-19 passport mean you have the record of vaccination, but it doesn't guarantee you're free from the disease.
Right. Professor Chu, going back to China then, authorities there claim their country has recorded no domestic infections in recent weeks. What are your thoughts on this?
Yes, I don't know if we can take that as face value, but see, this is the problem here. I think it has a lot of implications as to whether we can trust the statistics released by the Chinese government. The critical element to the vaccine passport to be effective is that we would have to have trust and confidence in Chinese information and data. And obviously, if we cannot take the Chinese statistics results and findings from the Chinese government at face value, then I don't think we can expect the vaccine passport will be effective and would have any meanings to the safety of the world here. So here, I think, well, I don't know if we can take it at a face value, but it seems like there's less and less newly found cases in China recently.
Right. Now, keeping in mind the concerns you just mentioned, Professor Chu, the UK itself is hoping to push for a global standard on vaccine passports during the G7 summit in June this year. What is necessary to ensure such an international accord, in your view?
Come again?
What is necessary to ensure vaccine passports, one that is accepted by countries across the globe?
Yes, I think just like I pointed out just in the previous question, obviously, building a confidence and trust among the countries is really one critical element aspect here, because otherwise we cannot build an institution here. An institution would be really critical because it would involve, a lot of requirements from all the participating countries. For instance, like data and information and transparency of the data among the countries, because and there has to be an international standard as to whether we can trust the vaccine and mutually recognize the effect of each country's vaccine here. So unless there's a common ground among the countries with international standard, and if we fail to build one at the upcoming G7 meeting, then I don't think the future prospect is too bright.
Right. Dr. Yu, the World Health Organization, as seen in the video clip earlier, has opposed vaccine passports, citing the lack of adequate vaccine supplies at the moment, and also some officials underscoring the potential prejudice, as you mentioned, of the presence of vaccine passports. What else do you think would be a problem in the case of vaccine passports?
Well, I'm on the same side of the official announcement of the WHO. Why? Because still the friends and the neighbor in the Africa and the certain South America who would never ever seen the vaccine, just they heard that. So which means shortage of the vaccination in this moment. If we started to the global, the standards is like a COVID-19 passport, which means that some of the countries who are developed it, like the US and OECD countries, they can traveling. But most of our friends from Africa, how they can traveling without the vaccine record? Which means there are two, we have to think about it. That time probably the vaccine record can be. It's like who made it to fake the passport in the traveling before the digital passport era in this moment. A second, probably my concern is fake vaccination also can be to going around the market, in the black market. So that's why we have to be moved forward together. It's like the human being respect to the dignity for each other. Why? Some countries far advanced finish the vaccination and they who say hooray and we are finished, but that doesn't make sense because COVID virus, it make the variants every single time probably will knock to our country and for human being to show to the different face of different character of the COVID-19. It's same as like the influenza. So from the 2009, we have only one strain of the vaccinated we started, but these days we have 4 different strains of vaccination every year with the different type of vaccination we haven't vaccinated, which means many experts, also me, COVID-19 should be going to be changed a little bit. Already the manufacturer pharmaceutical companies prepared for second line of vaccination already. So which means we're going to have a vaccinated nearly every year. So I'm agreed to make the certified of the COVID-19 vaccination. Yes, I agree about it. It's same as like use for yellow fever vaccination certificate. But green pass and COVID-19 passport to give certain selected people and selected countries, I'm negative about it. Same as like a WHO announcement.
I see. Professor Chu, here back in Korea, authorities, what do they have to consider, diplomatically speaking, if Korea itself were to endorse vaccine passports?
Yes, I think we have to be really prudent in dealing with this issue because there's, like I pointed out earlier, there's no international standard. And I don't know if our government is willing to share the data with other countries on our domestic people's health status. I think that there's one factor to be considered here, which would be privacy protection here, because at least part of our health information will be contained in the passport, and that could be shared with other countries' authorities and institutions, and we have to be really careful here. And the second is, I'm not sure if the government has gone this far to consider whether it is willing to increase the transparency over our own, tracking system of COVID situation in Korea. Unless we are willing to open up our database and, share the information with others and mutually recognize our quarantine process, then it's going to be a difficult challenge here.
Right. Dr. Yu, Israel has endorsed a green pass, like you mentioned earlier, allowing its vaccinated people access to cultural and sporting events within the country, that is. What is the impact of this initiative on COVID-19 containment efforts in your view?
Well, point of my understanding, for Israel government to encourage the people, especially for the young people who are registered about the vaccination and naturally, they give encourage and kind of a good opportunity to participating for the herd immunity. We can think about the influenza vaccination. We've been vaccinated nearly every year, especially for me as medical professional, but we got influenza. Why? Vaccination doesn't guarantee 100% free from the disease. But if you pass with a mild, and that helps to lessen the fatal condition for other people. So Green Pass, am I understand, not for the discrimination for the peoples are, probably Israeli government encouraged people for participating to the vaccination. So Korean government and other governments should be understanding about this for not for discrimination to the people who are vaccinated or not. This is kind of tool, our techniques, small technique to can be encouraged. Many people can be participating voluntarily to the vaccination will be good and will be good idea. But please don't use this green pass to make the someone who have vaccinated or not vaccinated. So we should be not use like a way of discrimination.
Right. Professor
Yes.
Chu, on a personal level, is the presence of vaccine passports a reason for hope or a cause for concern in your view? First.
I think it's definitely really two-sided coin here.
It is.
Yes, it is. But I like to be more optimistic here because I think people are getting fed up with not being able to travel abroad and not contacting and exchanging with people from other countries free of constraints and restrictions and so forth. So obviously, we are all up for it. For vaccine passport, that'd be a good idea, but it'll be up to the leaders and governments whether they can share the data and information that they possess, and obviously the critical element would be the results of the vaccinations of inoculation results, especially China, because China has not been willing to share the information on the results and the after side effects of the its own vaccines, and here, I think. But if we can have confidence and trust in each other and build a foundation of institutions that meet the requirements and demands of all these process, then I think vaccine passport would be very, very good idea to the recovery of the world and restoration of the prosperity and so forth.
Right. And keeping in mind what Professor Chu has just said, Dr. Yu, in your view, what are the remaining tasks, that lie ahead to ensure such a global standard on perhaps vaccine passports?
Well, vaccine passport, I believe, is inevitable because we're going to have it probably 1 or 2 years later for the global. But that point, my own point of my speech is the equity for not only for some countries and some nations and some ethic. So it's like a global citizen. We should move forward together. So 20 more years before, we have different type of the passport. After that, we have now electric passport in the standard for each country. Only color is different. So my suggestion is the same as like this. Whenever we have a vaccinated in equities, and they have all the nation have opportunity to have vaccination, but depend on the person who are rejected, so cannot be. But we have enough vaccination. It's like the flu vaccination in the moment. That time, the green pass or the vaccine passport will be good for all of our safety. But I can tell that Korean government should be considered how we can manage it, especially for corresponding to other countries. Because some countries make the high level of restriction to Korean nationality people who not vaccinated, because depend on the vaccination, who cannot have it. So it could be have something happen. For example, if Korean people who not vaccinated in Chinese product cannot allow going to the China, will be something happen. So before we start all the vaccine passport, we should figure out the matter of each country first.
Right, there are lots of sensitive issues to consider. All right, Dr. Yu, as always, thank you very much for your thoughts. And Professor Chu, it was great having you on the show today.
Thank you.
Right, now some pundits are claiming for those of us living amid the pandemic, COVID-19 vaccination looks to become a necessity and not an option. Thank you for watching. See you tomorrow.